A hernia is tissue bulging through either a weakness or a defect, typically in like the abdominal wall. Most commonly, we see hernias near the belly button or umbilicus or the groin. Some people don't have any symptoms, but most often we see people with like a bulge in either their groin or near their belly button. Some people have pain at that location that's ongoing because tissue's stuck in that area. Typically, someone with a hernia will have discomfort with heavy lifting in the area of the hernia. They will see that pain kind of come and go when they're doing certain movements such as lifting or twisting. If a hernia is incarcerated or tissue stuck in that hernia, sometimes they'll get bloating in the belly, nausea or vomiting, or they'll notice their stools have stopped. Well, we all have kind of this natural weakness as we're formed embryologically in our mothers. And typically it's recurrent lifting over time results in bulging through these weaknesses. Smokers are at much higher risk of developing hernias, and people that have obesity. If it's not bothering someone, then it doesn't necessarily have to be fixed, but it will never go away on its own, and it'll likely just get bigger over time. The things we are concerned about with a hernia is if intestine or something gets stuck in there, because then it can cause a bowel obstruction, it can cut off blood supply to that loop of intestine and become a surgical emergency. The hernias most of the time can be determined by physical exam. Rarely we do have imaging done if we can't feel it on physical exam, but most of the time we do not need any additional imaging. Occasionally we'll get an ultrasound or a CT scan if we can't identify it in the office. Hernias can be treated a few different ways. Surgery is the mainstay of treating the hernia. There's various approaches we use to treating hernias. Sometimes we do an open approach where we make an incision directly over the hernia, reduce the contents back in, and close the defect primarily. Other times we fix it through minimally invasive techniques, whether it's laparoscopic or robotic. We're more frequently doing robotic repairs of inguinal and ventral hernias or abdominal wall hernias now. I always provide patients with a choice of what type of hernia repair. I talk about pros and cons of each. All hernia repairs seem to be equitable as far as their overall outcomes, but patients seem to have less discomfort after a robotic or minimally invasive repair. If you think you might have a hernia or you're living with pain, I'd recommend getting in to see your primary care doctor, and if they are unable to determine if you have a hernia, get in to see a general surgeon, and we can help determine what the problem is and what to do from here.